70% of cancer is detected late in India, stage 3 and beyond. Treatment is less effective and much more costly in these stages of cancer. Can we reverse this trend? What will it take to create more awareness? Will new technology make early detection affordable? And most importantly, how can India create a larger pool of expert human resources? These are the questions that we're going to be addressing in the second edition of the series. GE presents Healthier India, Tackling Cancer Early. But first, a glimpse of the high-quality cancer detection technologies already in play.
Cancer patients in India are benefiting immensely from an advanced imaging technology called PET-CT, which helps doctors accurately pinpoint in a single exam the cancerous or benign nature of a growth. An advanced molecular imaging center at hospitals such as the Tata Memorial in Mumbai houses such a PET-CT scanner, which is changing the face of cancer detection and treatment.
Today in cancer care, we don't sacrifice any organs. For example, we don't do any breast mastectomy. We reconstruct or preserve the breast. We don't do any amputation because we put in live bone and preserve the limb. Similarly, we don't do laryngectomies. So technology and knowledge has improved significantly to be able to preserve good quality of life. Even in molecular diagnosis, biotechnology has advanced so much that we can do genomic sequencing, whereby we can see which are the genes present in the particular patient and which kind of treatment will work because of the gene expression. So a highly personalized medicine has been done primarily because of the advances in technology.
Our panel today can share many more examples, and I'm going to be turning to them for that. But first, a quick round of introductions. Tom Gentili, President and CEO, GE Healthcare Systems. Professor G.K. Rath, Head of the Cancer Center at the All India Institute of Medical Sciences. Charu Sehgal, Senior Director at Deloitte Consulting and Head of the Healthcare Vertical at Deloitte. Dr. Harit K. Chaturvedi, Chairman, Max Institute of Oncology, Max Healthcare, and Terry Bressenham, President and CEO, GE Healthcare India. Ladies and gentlemen, good to have you back with us. And I want you to add to the list of approaches, technologies, whether in detection or in care, that people should be paying attention to. Should we start with detection? Dr. Chaturvedi.
I have a very simple formula that any symptom which is lingering for more than 3 weeks, rule out cancer. I'll give you a few examples. Most of the other diseases have self-limiting pattern, fevers, lumps, feeling something, but anything which is there for more than 3 weeks, just be aware, especially if you are in the age group above 30, I would say, generally we say above 40, but above 30, get cautious. Above 40, you have to be sure. Now, episodes like one episode of bleeding per rectum, one episode of abnormal discharge, anything, even single episode, one has to rule out cancer. And third group will be a high risk population like smokers. Tobacco is a very big high risk group. So I would say if you have anything, first thing is rule out malignancy if it's there for more than 3 weeks.
In oral cancers and cervical cancer, you don't require big technologies. Simple looking at mouth every day, which most of us do every day, is good enough to self-detect cancer. Otherwise, if you want to go as a public health approach, a person who is educated up to graduate level can be trained for 2 weeks, he can detect oral cancers. Cervical cancer, our ASA workers or trained ladies can look at this service and detect it. In breast, certainly we require technologies. And in collaboration with the ladies, they have to do self-breast examination once in a month in between the 2 cycles. And so far as the detection is concerned, mammograph is the gold standard. If there is a high risk factor, suppose somebody has a genetic risk, somebody has a breast cancer in the family, one should do it before, but not mammograph. Maybe MR or ultrasound, because they are not radiation generating.
Tom, add to that list and walk us through it step by step.
Mammography has limitations. For example, if a woman has dense breast tissue, and about 45% or more of women have dense breast tissue, a mammography might show up negative. That doesn't mean you don't have cancer. It just means the mammography didn't see it, because the dense breast tissue shows up as white and cancers show up as white. So the cancer can be masked or hidden. So in that case, it's advisable to get another form of imaging to see if there is a cancer in fact. And if you don't have any other risk factors, something like an ultrasound might be the appropriate way to go. We found in a trial in the US, 15,000 women, about 30% more cancers were found for women who had a negative mammography but had dense breast tissue and then used ultrasound.
Finally, Charu, bring the public health perspective to bear on this.
Yeah, so I think the fact that all of this technology is available, I think it's the first step really. You need it. I actually believe that we need to give it a global focus, a national focus, and maybe put it into an MDG goal. Because wherever there has been a global focus and a goal, for example, infant mortality, maternal mortality, we found that suddenly, resources are geared to it, sort of planning is geared to it. So I think if it gets that kind of a focus, and then different players, it has to be communities, it has to be corporates, it has to be employers, it has to be government. Everyone has to put their might behind it in the last 5 or 6 years. Just because it's something which is talked about, people are actually going and getting themselves tested. So I think that will complete the picture.
And this conversation today is a step in that direction as well. Charu suggesting maybe you need to really put it as a global objective or a national objective, but I keep coming back to two themes. One is affordability, and the other is the existing infrastructure already. How woefully short is it? And I think it's important to take stock of that infrastructure here in India. That's after this quick break. You're watching GE Presents Healthier India, Tackling Cancer Early. A lot of it just boils down to an individual's will to fight cancer.
I was going for a shoot, and there was this big blisters in my mouth, big red blisters, and it was really odd. And so, like everybody, I couldn't think. I just thought it was a blister. I never thought it was something dangerous and it can be life-threatening. And my wife insisted that day, and she came halfway. But we have to go and do a blood, go to a doctor, and then go to the shoot. So doctor saw it, and he was really worried. He took a lot of tests, did the blood test and everything, but I went to the shoot, and I was absolutely normal. It's not that I was tired and I couldn't shoot. I was shooting, but there was huge blisters in my mouth, and for the last few days I have been spitting, but with some blood. When I was toothbrush and everything, there was a lot of blood coming out of this thing. So I thought there was some bleeding inside, maybe from the tooth. But then I was diagnosed with cancer, acute leukemia, and my cancer cells started multiplying very fast. And I was admitted, and I was not getting any positive response from the doctors and people who were diagnosing that I'm going to survive. And treatment went on, and because of the treatment and because of Dr. Banawali from Tata Hospital, I'm here talking to you. But like everybody else, I thought it can never happen to me, but it was happening to me.
I discovered I had a breast cancer just by chance. I went for my first mammogram 13 years ago, much later than I should have been going, and they detected the early stages of a breast cancer in my left breast. It was quite shattering, the whole experience. Even though you think you're well educated, traveled, exposed to the world, and on top of situations, information, when it actually happens to you, you realize how little you really know. And the first question that hits you is, why me? The next thing is to find the professionals, the doctors, the oncologists who can help you. So of course, knowing a lot of people who'd gone through cancer earlier, I was taken to the right doctor, went through my treatments, and then I started realizing that, in India, women just don't take breast cancer seriously at all. And if I had been a little more on top of the situation, I would have been getting my checkups, mammograms done at a much earlier stage. At least from the age of 40, it's recommended every 2 or 3 years that women go for a mammogram. I think I was 48 when I went for my first. It was very lucky that it was caught in an early stage, so I really didn't need to go through even chemo. I had to go through the radiation, but just the whole experience was quite shattering.
Tom, you know, this is a broad question. When you look at the approach to cancer treatment in India and compare it with the approach adopted in the United States, what are the big differences that you see?
Well, one thing that I see even in the US is really a lack of process focus in terms of the workflow of patients through the whole system for breast cancer. So in other words, a woman could get screened and they could detect an irregularity and they could say, you need to come back. It's called a recall. And the next appointment could be weeks or even months away. And then after that, there might be a need for a biopsy, and that could be more days away. And then surgical treatment or radiation treatment. And so the length of time, the throughput through the whole continuum of care could be months and months. And those are sleepless nights. And that means that it's not just about early detection, it's about having the infrastructure in place to follow up. Because if you just detect cancer, but then you can't go to the next step, in other words, do the definitive diagnostic, do the biopsy, do the staging, and then the treatment, then we won't get the outcomes that we're looking for.
Charu, does anything come to mind if I ask you how woefully inadequate is the hard infrastructure in India? And here I mean hospitals, machines, properly equipped.
It is inadequate. Having said that, I think, you know, sort of a need is driving innovative models, and therefore for us to think that, you know, all we want is a comprehensive sort of center and several of them, that will take some doing because it's expensive. So what we can do is innovations on wherever. For example, there are already some innovations. You know, there are some small nursing homes which are offering chemotherapy, just sort of daycare for chemotherapy. There is somebody who's offering, you know, surgical oncology. You don't necessarily have to have it all in one place. But I think there is a bare minimum numbers that we need of the comprehensive care, which would be the hubs. Right, and to some extent I think the government has woken up to it. Our new program, our 12th plan, actually talks about a lot of investment in cancer, its prevention, detection, and more importantly, palliative care. We are so woefully inadequate on palliative and rehabilitative care, and if you have to look at a continuum of cancer, you cannot ignore that 40-50% of them will need palliative and rehabilitative care. So that's something we need to also do.
You know, the soft skills, the soft infrastructure. I'm basically talking about human resources. And what's your experience on that side of the issue, Terry, here in India?
Well, I think on the side of the expertise that's needed to do cancer detection and treatment, which is your question, I think here I would give the government a really strong endorsement for the activities they've done around the National Skills Development Council, and in particular the healthcare sector skills development, where they're putting real money. There's a great group of people behind it. There's a progress that's getting made, and the standardization or standards being set out for the country on the number of experts that it would need to run cancer detection as well as other parts of healthcare well. I applaud the government. I mean, 4.8 million jobs to be created in healthcare by the government's initiatives with real money behind that. I think that's a huge step forward.
Well, on that positive note, let's take a quick break. But I do want to explore more examples of the kind of partnership that Dr. Chaturvedi just outlined. We'll do that after this quick break. Welcome back. You're watching G Presents Healthier India, Tackling Cancer Early. While we're on the subject of awareness, there are indeed actually a number of non-governmental organizations doing commendable work right here in India on the awareness side.
Cancer is the leading cause of death in India. What is lesser known is that 30% of cancers can potentially be prevented by avoiding risk factors such as tobacco use and obesity. Many other can be successfully treated and possibly cured by early detection.
मुझे कैंसर है।
Need of the hour thus is awareness amongst the population of getting regular checkups done, and organizations are doing their utmost to take this message to the people.
Conquest of cancer by choice, not chance.
So the aim of Indian Cancer Society is to reach out to as many people as it can and get them aware about this disease. Because what we find is that if this disease is detected early, the chances of recovery are very good. Our main aim is to reach out to all the people about the breast cancer awareness and cancer as such, because cancer is curable, and as you know that 1 in every 10-12 ladies is suffering from breast cancer. So if there is an early detection, early discovery, early detection, early discovery, early recovery. So that's our main aim, and we want people to take care of themselves and go for checkups regularly.
2 years after I actually was treated for cancer, I set up a foundation called the Women's Cancer Initiative in partnership with one of the leading hospitals in the country that deals with cancer, the Tata Memorial Hospital in Mumbai. And this came about because my radiologist who was treating me at that time was the director of the Tata Hospital then, Dr. Katie Dinshaw. And in conversations with her, she said, I see your energy, I see your dynamic, you do a lot of things, you're helping various causes. Why don't you come and help us to first of all create awareness on the importance of early detection. So the first thing was the foundation set about doing was starting to create awareness about the importance of early detection, that women please don't think it can't happen to you. Second one, and even more important, is raising funds through the foundation to pay for the treatment of women who have a chance to survive but don't have the finances. And it's very heartening to see that we've managed that nearly 500 women every year are being given financial help from our foundation for their treatment. We've had a lot of people come to us and say, we'd like to do something for your foundation. We're seeing the work. The Times of India group actually started something 5 years ago called the Lavasa Women's Drive, where hundreds of women get into cars, drive from here to a wonderful hill station near Mumbai and come back, and they decided to do it for breast cancer awareness, and funds that are raised are donated to our foundation. We have lots of other events. We have something called the Pinkathon we're doing now every year with Milind Soman for the last 2 years, where a 10-kilometer run especially for breast cancer awareness, raising funds for the foundation is happening. We've had many celebrities come forward and say, Devika, let me know ever if you need our help, and I do take them up and I say that it's really for a cause, we need you, and they're always there. I had to go through something, but maybe there was a reason for that, and I look at it in a much deeper sense of the word, and I say that maybe this was a gift given to me to be able to do something, and I'm very happy that I am where I am at this stage.
Cancer, a taboo subject here in India, but the government can play a huge role, and I'm sure it's already playing a role. But when it comes to awareness programs led, steered, executed by the government, Professor Rath, are there any recent developments that give you hope?
Recently, government has launched a very, very impressive program called NPCDCS. It's called National Program for Prevention and Control of Cancer, Cardiovascular Disease, Diabetes and Stroke. Because all these 4 diseases have a common etiology, can be tackled, together. And what has been done is, we have 640 districts in this country. 100 districts have been taken, and in all 100 districts, this program has been implemented, and that's led to huge success.
Briefly, Charu, do you share Professor Rath's enthusiasm on this?
Yes, I do. In fact, interestingly, I think we all recognize that there's a huge shortage of resources. We are 6,000 short on medical oncologists, some 7,000 short on radiotherapy technicians, and the number goes on. And in the short term, trying to tackle that is going to be difficult. So technology, telemedicine, mobile medicine is being used in a big way to actually tackle some of this. So you have these good resources in one location. Kerala is doing something very good with OncoNet. So I think as the needs are emerging, so are solutions and innovations.
Dr. Chaturvedi, the medical community itself has a role to play, and I think it starts with the general physician, what we call the general physician here in India. I would argue that they're a difficult to come by breed today, even in big cities like Delhi. And reflect on that issue. What is the starting point, and who then becomes the torchbearer for that awareness in the medical community?
So I'll say the ownership belongs to the oncology community at large. I won't shift the ownership to the primary physician, because for them there is a whole spectrum of things to handle. We have to reach out to the medical associations, to the primary level physicians, engage with them in a continuous dialogue to make them more sensitive and aware to how to diagnose and pick it up early.
Terry, you've actually worked in many parts of the world. On the awareness side, are there any experiences globally that you've had?
Well, I think there's been a number of national programs that other countries have targeted to bring out the awareness, supported as in many cases by policies that paid for or supported the cost of getting screened. We take our cars to the garage regularly. We have no issues. We didn't used to, but we now take our cars, our schedule maintenance, we take our cars. We need to think about our bodies in the same way.
Tom, final word from you on awareness.
There's an organization in the U.S. that GE's had a long association with called the Susan G. Komen for the Cure. And the woman who started it, Nancy Brinker, had a sister who died very young of breast cancer, and she started from scratch and created a multi-billion-dollar organization that funds research, it funds breast cancer screening, not only in the U.S. but around the world. And I think one of the things that they've done that's very interesting is they've created a community around breast cancer. So families that had a breast cancer patient who died or survived get organized into runs. And they have these runs for breast cancer that take place once or twice a year. They generate a lot of funds for research. It increases awareness, and it makes people, therefore, more aware of the risks involved, and encourages them to go and get screened. That's a very successful organization.
Well, on that note, it's a wrap on this edition of GE Presents Healthier India, Tackling Cancer Early. Next week, we will flesh out more models for collaboration. We've already had a sample of some of the collaboration schemes already in play here in India when it comes to cancer detection and cancer care, but I'm sure there's lots more that can be put on the table. That's next week on the show. Bye for now.